You have 30 seconds. Pick your best answer. All right. We have a patient with PTSD. You want to recommend the core of the questions. What therapy will you recommend? EMDR, DBT, EMDR again, and CRT. 5, 4, 3, 2, 1. Good job. All right. So this was tricky, right? A bit tricky, right? And why did I do that? Because the board is known to do that specifically when it comes to words that you should know. So what are they? Pico. You should know by the letter what pico is because they might ask that question. And they'll put all P's the same, all the O's the same, all the I's the same. Another one that you need to write it down is cage. It may seem simple now, but when you are question 175, tired, scared, afraid of what you will be results, and they put a question with the cage and it's all the C's the same, you might get it wrong. These are easy hanging fruit. Congrats, you guys. Let's take a look on the answer here. All right. So who was super fast? Ooh, man. Look at you. All right. So here's the answer, right? So EMDR, it's eye movement desensitization and reprocessing. So let's talk about EMDR real quick. I'm not going to break this down, but you need to know the phases. They are known to give you a scenario and ask which phase is the patient currently in. So write this down. So immediately after Kahoots today, you go back to the books and you look for the phases and kind of understand what's the phase. You don't have to memorize the phases precisely, precisely, but you have to understand if a scenario is the patient's crying, if the patient is calm, if the patient is the installation phase, or what have you, whatever phase it is, you need to know in case there is a scenario that shows up and ask you what phase of EMDR. Second point, every time you see PTSD, your first therapy should be EMDR. There are many others, but the board loves EMDR. Okay. Again, this is not a real life scenario. This is for the board preparation. Do not confuse. And that can be a deadly mistake. You may lose some points if you do. Next question, get ready. All right. So important, we're looking for the exception. Ooh, it's kind of hard question, isn't it? So which one is an exception here? Doxepin, escitalopram, cloprimamine, or impramine, right? So let's say you got stuck with these questions and you do not know the answer. Use process of elimination with some background of what you know. Which of those questions can you eliminate right now? If you look, let's wait. And we are going over the answer. Wow. Okay, we're looking for the exception, right? So good job. Oftentimes we, get confused between the exception and the correct answer. But let's say you were stuck. Okay, you didn't know what class of medication was clomipramine. Look at the below. It has imipramine. So by the last name, you should eliminate the blue and the green. And then look at doxepin, right? And then you know escitalopram. So that should have been easy. Maybe you guys got this. Some people got this confused because you ignored the except, right? So good job, everyone. Most of you guys did well. man, Fred is not letting anybody take the lead today. So here is a bit more of the rationale. We're looking for the exception, right? So there are our five most famous SSRIs, and we have the others, TCAs. No, notate this. What somebody come on, unmute yourself and tell me the reason why you do not prescribe a TCA over a SSRI for someone that has major depressive disorder. Anyone give me an answer, please. Unmute yourself.
Mania.
Which,
Choose
which
the
for
mania.
suicide?
Okay, I heard mania, I heard suicide. You both are right, but the main reason it comes up on your test is because SSRIs are safer, right? If someone ingests a bottle of escitalopram, they may have, you know, stomach ache. They will have stomach ache. They will have many complications, but most likely it's not deadly. Okay. Actually, you'll be surprised how much it takes to kill someone with medications. You know, there's a book just for that. Now, if they do take the entire bottle of amitriptyline, they should never have a headache after that. Just kidding. Um, they likely to have a cardiac problem, and this is the reason. So this question is important. If it shows up on your test, because SSRIs are safer. Now, second point, really far away, is that you should never prescribe an SSRI or any antidepressant, with an exception of one or two. This is why I had to pause. For those with a history of mania, you could put them into a manic state. Which brings another point. The other point is if someone has a diagnosis of whatever, more specifically PTSD and acute stress disorder, but in this case, bipolar 1, bipolar 2, or major depressive disorder, they are always the main diagnosis with a specifier. What am I talking about? Someone comes to the office, real life here, and is depressed, right? You first time seeing the patient, but you neglected to look at the history and you prescribe a SNRI or SSRI or what have you, and you give the medication because the patient presented with depression, but now you just put the patient into a manic stage. Real life, I seen it done it because someone forgot to look at the history that had the history of bipolar and instead gave a new diagnosis of major depressive disorder, right? So let's move on. Next question. Get ready. Use process of elimination, guys. All right. We have about 15 seconds. What is your best answer? Okay. All right. Maybe we need to start a little bit more the cranial nerves. Okay. That's important. You're likely to see one question on your cranial nerve. Which ones are mainly important? 3, 7, 3, 7, 9, 10, and 11, and actually 12 often comes up on the board. Okay. So Claudia took the lead here. All right. So let's take a look here. Accessory, right? We could easily done process of elimination on that question. Okay. So if you get stuck, default to process of elimination. First option is always knowledge. So cranial nerve 11, assessment of the strength of the of the muscles of your shoulders, right? So against the resistance on the provider's hand. Then you have the trigeminal, which is the 5, right? So that nerve assessment of the mastigation muscles and the facial nerves, right? You have 7 there, assessment of the cheeks, blowing the cheeks and things like that. Should know those 3 nerves, they're actually very important for your test and real life. So we're looking for diagnostic differentials here, right? Difference diagnosis. All right. What are you thinking of? Right? Sounds like something's going on. Intimate partner violence, non-insured or underinsured, drug abuse, or homelessness. All right. So we had one person that unfortunately maybe miskeyed, right? So this is a classic case of intimate porn violence. I think this question was a bit easy, so I'm not going to dwell on it. Jeanette took the lead. Congrats. Kate, 3 in a row. All right. This is an important question. It may be on your test. You should know. Again, accept. Okay. Which of the following would you be the exception? All right, you have about 30 seconds. Pick your best answer. Okay, we have 20 seconds left, guys. Pick your best answer. This is an exception question. You're looking for the things that are most likely. Okay, so here we go. Right? Let's take a look on the rationale. Be always wary when you see exception. Ask yourself, what is the question asking me? Okay. So here's the rationale. Urgent and acute care treatment of symptoms of homeless individuals who are mentally ill, right? Although urgent and acute treatment of symptoms of homeless individual is part of the treatment, it has little to no lasting effect when it is the only treatment provided, right? It is not sustainable. It is not supportive in the long term goals of reducing homelessness. That should make sense as you read the question. Ask yourself, what is the question asking me so that it becomes clear on your mind what you are answering. Okay. Just like you have to always think of a way that you are answering your question and stay consistent. So that way, the way you train is the same way you fight. Okay. Next question. We have another exception. What is the question asking you? This is actually a very good question that has been. There was an article that came out that said these three things, but I did not say one of them. I'm not going to tell you which one. All right, but this is a true statement from an article that's very popular. What are we looking for? All right. So it should not say that the nurses should be ethical, victorious, and I don't even know what was the question, the answer, but it was not aid. So here is what it said, right? Nurse should practice to the full extent of their education, hopefully in one day in every single state. Nurse should seek higher level of education through seamless academic progression. Nurse should be full and equal partners with physicians, and to improve the quality of care, nurses need to improve information infrastructure. Okay, so there you go. Sometimes, like I said, option A, don't know where to go, have no idea what to do, don't pick A. Okay, usually is a trick question. We put something there that sounds good. Okay? Only if you don't know the answer, please. Here again, I'm hopping on in the same concept of exception because I see a lot of errors, not of knowledge, but test taking strategy. So here we're talking about phobia more specific, right? We can make two questions out of these questions. One is the exception. You should not pick DBT. DBT is for borderline patients. And the second point here that I need to tell you, you already know this because you're in my course, is that DBT, who created DBT was Marsha Linehan. She had DBT herself. And the funny thing is the therapist, after they finish a whole section of DBT. DBT is very, very intense. They actually need therapy, okay, as you can imagine. Now, exposure therapy, it's one of the classics that we do for trauma and anxiety, right? So here's the rationale. Most of you guys got it correct. Second point, DBT. What is the goal of DBT? Decrease suicidality. Guys, I'm putting a question and I'm giving you many answers that might be on your test in one way or another. So if I'm talking about hopping on a point, would be probably a good thing to write it down. Goal of DBT, who created DBT, and who DBT is for. So I give you an acronym, DC step on the course, so you know all the goals of DBT. But the main one is to decrease suicidality, decrease crisis. And it could come as decreased crisis, right? Next question. Who is responsible for monitor the standard of care for NPs? Questions like this often got me confused. Is it the state? Is it ANA? Or, is nationally? Pick your best answer. All right. The State Board of Nursing, independent employers, private insurance companies, federal government agents. Most of you guys who have 25 answers, do your best. So the core of the question is actually written. Who is responsible for monitoring the standard of care for MPs? Who if you make a mistake, who responds for that broadly, right? It's not going to be your employee that will, that would probably the first thing, but it's not generally, right? If there is a mistake, then the state board of nursing is responsible for that. Okay. If you ask a question, I cannot see you. You just unmute yourself, please, and ask the question.
Oh, Dr. Lopez, I was
Yes.
wondering, wouldn't it be like the ANCC or AANP?
No, that's nationwide, right? If you made a mistake in Mississippi, there'll be a state board of nurse that will um, have to say, "Hey, you can do this in the state, or you cannot." Right? A and A will broadly say, "Hey, this is what what all nurses of your training should do," and the state will restrict or amplify what they think is the best answer there.
So,
Okay.
Dr. Lopez, this says the federal government agency.
Right. But tell me a little bit more about that, though. What do you mean?
No, but it shows the federal government, but you did mention that it's the state board of nursing.
Hold on a second. Let me
What's the
take a look.
correct answer here?
Yeah.
So, actually, did I key it in incorrectly? Uh,
Yes.
the correct answer is the federal government agents. The standard of care are now being set, monitored, or publicized by the government agents. I think I incorrectly keyed in, huh? Or
Yes.
did I say okay?
So you're gonna strike out that answer, or you're gonna keep it?
Strike out. So the correct answer is the federal government agencies. The standard of care are now being set, monitored, and publicized by the government agency, as well as certain self-appointed consumer-oriented agencies. These groups include Medicare, Joint Commission, National Committees of Quality Assurance, and the Agents of Healthcare Research and Quality, right? So the State Board of Nurses is not the correct answer. Monitor the
Okay.
standard of the care is beyond the
Federal
state
government.
regulation, okay? So
Okay.
sorry about that. I think I incorrectly keyed in the question. I didn't even pay attention. Huh. Okay. Next question. But all right. So we're looking for the patient's symptoms here. Most likely the cause, right? Sleep disturbance and low moon has been this way since the death of her husband. So we have a symptom and a condition.
Excuse me. It's not even answering me.
Okay, you still have 45 seconds. So let's enlarge the question. Mhm. Do process of elimination. Okay. So it said 1 month, right? So the 1 month was the key to this question. Why not major depressive disorder? Right? Here we go. So in this case, due to 1 month, it was a normal grieving process, right? Now, had it been had been 6 months, I'm just giving you a number, this would not be normal at that point. Why not major depressive disorder? Well, oftentimes we cannot pinpoint what caused the symptoms. In this case, we can. So in this case, we could be looking at the adjustment disorder, possibly as one of the answers, or in this case was more specific for bereavement and adjustment disorder would not be one of the options. Okay. Next question. Which of the following is the most appropriate medication? Medication. Look at the age. Well, and the symptoms, right? Look at the age and the symptoms and match your best medication choice. A little bit of art and science here, okay? Actually, it can be a difficult question here. Okay? I'm going to unmute you here just for a second, please. We can discuss this question after. Okay, so let's take a look here on the rationale of this question here. Okay, so it's a bit of it's a difficult question, right? So let's talk about fluoritine, Prozac first, right? It's incorrect because it's a central nervous system CNS activation. So we could eliminate that just because of that process of the insomnia. So you don't want to activate the patient. Let's take a look at paroxetine. By the way, paroxetine is one of the worst medications, in my opinion. It will deliver a very strong sexual side effects. Okay, often used in prisons for whatever reason they do. Is incorrect, as there is little evidence supporting its safety use in children and adolescents. Now the question is, right? Sertraline or Zoloft is incorrect. It can cause central nervous system activation and is likely to exacerbate insomnia in patients when sleep disturbance. So, very hard question, right? And bupropion is incorrect. It can exacerbate sleep disturbance and is not recommended for use in children and adolescents. So in this case here, you could um, do process of elimination, but I can tell you this is there would have been a very hard question unless if you could deeply understand those medications, it would be very hard to answer. Okay. Next question. Very hard question. So we looking for benzodiazepine discontinuation. How do those patients look like? Are they going to have psychosis, nightmare, death, or grand mal seizure? Commonly included in the signs and symptom of benzodiazepine discontinuation. So you could do process of elimination here. You probably not finding the easy answer, right? Otherwise, everyone will get it right. So you got 5 seconds to pick your best answer. Mm. Okay. So how could we use process of elimination? All right, death, it's possible, but is that common?
No.
Seizure is very possible. Well, it's more possible than death, but is that like the main symptom that we see? The question said commonly, psychosis. Do the patients get psychosis during discontinuation? Is it more prevalent than nightmare? Right? So the question was most common or commonly uh, in the stem of the question, right? So we had to pick the one that occurs the most, right? So it would be sleep disturbance due to the rebound in the rapid eye movement and so forth, right? You would find, think about it, benzos. What benzos do? Put you to sleep. If you take the benzos away, what would it do? You'd be having rebound syndrome. Okay. All right. Hopefully this was a little bit more clear. Guys, today's event is a little bit harder. There's questions from all over the place. It's to stress you out. Okay. Which medication is most appropriate to relieve her symptoms? The schizoaffective, depressive type presents to your office for follow-up. Okay. So let's take a look here. Okay. Okay. So the symptoms are consistent with akathisia, okay? Which this is the EPS symptoms, you know, consistent in difficulty in staying still, subjective of restless. Okay. Now let's take a look on schizoaffective disorder. What is a schizoaffective disorder? When you hear schizoaffective disorder, think of it as schizophrenia and mood, right? I'm being I'm putting in the simple terms here. So symptoms of both schizophrenia and mood. So if we have the core symptoms is characterized in these two areas, the psychosis related symptoms, which is part of the family of the schizophrenia, you have hallucination, delusional, disorganized thinking, speech, and abnormal motor behaviors, right? And then you have depressive episode and manic episode. So what you really want to, when you hear schizoaffective, think of schizophrenia and moods together, right? And what you need to do to treat the person. Okay. All right. So today we are doing a lot of odd questions. Okay. So if you're not doing super hot, don't feel bad about it. It's meant to stress you out. It's meant to uncover one or two things in today's event that will help you on the board because it's likely that you find questions on the board that you didn't hear about it. And if you come to that question and you didn't see the question before, it is a likely throw out question. I want to repeat this because this is important. how do we select questions for the board, or how do uh, the organization, they have to pre-test those questions. When those questions reach a certain percentage, about 75 or so forth, they'll say, okay, those questions are valid. If the question is too hard or inappropriately written or doesn't give you enough cues, most students will not get it right and the question is thrown out. Making questions is difficult, okay? uh I cannot see you, so if you do have a question, please raise your hand or speak. Actually, speak, please. So we have about 90 seconds for this question. Which of the following medication likely served as a precipitant of the clinical presentation? So here we have it. All right, we have 5 seconds left. Pick your best answer and go. All right, quetiapine. Wonderful medications for those with very, very difficult insomnia. Okay. Uh, okay. Here's the answer. Very hard, right? 90 seconds. Ooh, is a repeat question? No. Okay. Hard question, right? Look at the cue. She fell and sustained hip fraction. So you could possibly eliminate one answer right away. Ten seconds. All right. So here we have it. So doxapine, right? We give that mostly for someone that have insomnia. Could be given, right? So you could eliminate doxapine right away. Then amitriptyline, we give that for someone that usually is having a migraine. So these are very old, uh not not triptyline. So they are very, very similar. Okay. So let's take a look here on the rationale. I know these questions are killing because they are hard questions, right? Be careful when you transition from a TCA to an SSRI. You should wait 2 weeks. When transitioning from a Prozac to any medication, specifically antidepressant that I'm referring to here when I say any, you should wait 5 weeks. Okay, make that point is important. All right, we have about 25 seconds. All right. So let's take a look here, guys. Accountability, right? Why is that the best answer here? Okay. So the nurse has authority, accountability, and responsibility for nursing practice, right? When you hear advocacy, they think about doing something for the patient or fighting for the patient's right. Okay. Now, when we say autonomy, you are very close answer, right? Is a rationale for self legislation and self determination, and is grounded in the informedness and voluntary consent and rationality, right? So, for the best answer here would be accountability. Okay, hard question too as well. It can be tricky because many would think this would be autonomy, right? 90 seconds. So the patient had a surgery, now acting a bit different. So, what is the condition and what tool would you use? Okay. Well, I'm surprised people didn't pick the CAM ICU as the most one. But let's take a look. The CAM, right? Being ICU nurse, that would be my first uh, choice, oftentimes, right? So the CAM assessment is the ideal tool that is preferred for diagnose delirium. That's why I always come to mind CAM ICU because we did that every day in patients quickly due to its easy use. So it is the correct option, right? So you need to differentiate between delirium, um, pseudo depression, and also also between Alzheimer's. Okay, is someone raising your hand? I cannot see your screen. If you do, please go ahead.
Dr. Lopez, I thought you said you meant delirium would be the correct answer, but here
No,
shows so
so it's asking for the tool to use, correct?
oh the tool. Okay.
Yeah, asking for the tool. So what tool would you use? In my mind, I always, because I've been an ICU nurse for so long, the first thing is I would think came ICU, right? But obviously, it's a 3 days post operation. There was no complication with the operation. The patient would not be in ICU, right? But in my own mind, because the way I did my training process, right, in ICU, that would have been what I would think rationally. So that's a good practice because if you are a family nurse practitioner, you have to think differently. If you are a ICU nurse, you have to think differently because it's not about your previous profession. Okay. Next question. Which of the following is the most appropriate initial psychopharmacology, psycho, psychopharmaco, psych, or psychopharmacotherapy for in this page? So we have a 90 seconds. So all right, seems like most of you guys picked your answer. Let's take a look. Good job, everyone. You should know what the condition it is referring to. Nice. D is back with an answer streak of 3 times in a row, getting right. So let's take a look on the rationale, right? What I want you to get out of this question is what are the 2 medications that you could use for NMS? Anyone?
Dental
Okay.
something.
Dantrolene and
Bromocriptine.
bromocriptine. Do not, okay.
Polydor.
What do we use for serotonin syndrome? What's the name of the medication?
Crypto.
Okay. Do not confuse those 3 medications. Now let's go back to NMS. If if the question asks which of the following medication is a dopamine agonist, what would you answer?
Bromocriptine.
Okay, think about it. Makes sense because it was a dopamine antagonist that caused the condition. So you want to reverse with a dopamine agonist, right? If the question asks about a muscle relaxant, then dantrolene most likely is the answer. Do not confuse or cyprocryptidine. People confuse that all the time, and you need to know how to distinguish NMS versus serotonin syndrome. Okay? Which of the following statement best describe the features of the Individuals with Disability Education Act? Okay. Broad question, right? We got 30 seconds left.
Je comprends une question. Là.
Okay. Most of you guys got it correct. So let's take a look on the answer choice. And Jen, still taking the lead. Today's event is very hard, guys. So, okay. Here you can take a look on the rationale. To receive free appropriate education to early intervention, i.e., and special education service under the Individual with Disability Education Act. Okay. Okay. Next question. Oh, I'm sorry, Joycelyn. You had a question. I'll follow up with you in the next question. Okay. 60 seconds. So the core of the question is most beneficial for the patient in this scenario. Okay. So this question here, I want you to emphasize one thing. Stay away from anxiolytic on a board as much as possible. You would go to anxiolytic when it's as severe. Okay. So the board is all about safety. So you stay away from anxiolytic unless if it's very severe. Second point, when the scales are super high, especially depression scales, the 4 scales that we have talked about, your number one action is no longer to give medication, would be to assess for suicidality. Not quite related to the question, but I want to emphasize that point. Okay. So ground technique and deep breathing still would be the most appropriate in this scenario here. Okay. And that makes sense, calming the parasympathetic nervous system and decrease the anxiety naturally, right? Right. And it was no indication of a trauma in this case. 60 seconds. If this is you, I hope not. Okay. Hypomania, right? So let's take a look here on the rationale. It's kind of weird, this one. Did you know that most CEOs have hypomania? Not literally the diagnosis, but have symptoms of, right? Okay. So for this one, you could have done process of elimination. I know doesn't quite define hypomania, but the test questions often may not give you a super easy clue. Okay, Joycelyn, I noticed that you had your hand raised. I could not see it. Do you still have a question, or should we continue?
Continue, Dr. Lopez. Thank you.
All right, thank you. All right, next question. So we're looking for a disorder symptoms, right? We have 90 seconds. Use process of elimination. Process of elimination would do well for this question. You have 5 seconds. Pick your best answer. Pick an answer. Okay. So process of elimination for this question would have worked well. Okay. So most of you guys use the technique there. So let's take a look on the rationale. Often test questions will come related to veterans and PTSD. You need to differentiate between PTSD and acute stress disorder. Now, we know that you know that acute stress disorder is less than a month. How test makers will try to treat you is by saying the person has PTSD and the incident happened, like a car accident. Now the patient is scared, doesn't want to leave home, feel touched, having nightmares, and so forth, right? And they say that the accident was 2 weeks ago, and they ask you which of the following most likely the diagnosis. So just like PTSD and acute stress disorder, just like major depressive disorder, bipolar 1 and 2, once they reach the diagnosis, they should stay with the diagnosis, right? So just be careful, even though if the question give you a time frame, is not a specific. It could be something else. It could be a tricky question. Okay. Oh, I can't stop right now, but I'll get back to your question in a second. Okay. All right. We have 90 seconds here. So, which of the following criteria of schizoform disorder will differentiate from schizophrenia in this patient? Okay, so let's take a look here. Most of you guys got it correct. Good job there. So this is the rationale for this question. Now, when we say schizophrenia, right, we're looking for the duration that that lasted between 1 and 6 months. Characteristics can be psychosis, similar to schizophrenia, including hallucination, delusion, disorganized speech, and behaviors. Outcomes usually around two-thirds of the individuals diagnosed with schizoform disorder eventually develop a schizophrenia, right? So before they develop schizophrenia, I want you to write this down. What is the time frame for males and females that are prone to schizophrenia? I actually see most acute schizophrenia in my line of work because I work with younger males. So for males, 15, 18 to 25 years old, female 25 to 35. That's important information that you should write down. Now, when it comes to this is a schizoform, right? When it comes to schizophrenia, duration, it can persistence for 6 months or longer. So I do apologize, I misspoke here, right? So 1 month to 6 months, schizoform disorder. Again, schizophrenia, it can be 6 months or longer. I misspoke. So the characteristics includes the same psychosis that we discussed, and generally a lifelong condition, although symptoms can vary in severity and over time, right? So there was a question before. I couldn't see the screen. There was anyone that raised your hand that would like to ask a question?
Yes, thank you, Dr.
Uh-huh.
Lopez. I did not know what the answer was
Oh,
for the question before. What was the answer?
I
Don't
don't even
remember.
remember because, but we can write this down and try to go back to it because there's so many questions. I've been up since like 4 in the morning here because of my different times, so I can be a little bit of a, uh, you know, distracted at times. But we can go
Yeah,
back to it and then we'll look
no,
for it. Okay.
it's okay. It's okay. All right, thank
All
you.
right. Uh-huh.
Mhm.
The mental state of the patient is being examined. How will orientation be assessed? So we got 60 seconds. We're assessing for orientation. We actually could take two questions that is 2 points that are important from this question. Okay. So orientation, I want you to, this basic nursing place, location, date, and things like that. Right. Now, I wanted to call your attention for subtracting by 7 rules. If the question asks you where in your assessment would that be called, or what are you assessing for? You're assessing for concentration, right? Um, assessing for concentration usually would be the answer for that. Counting back words, or writing world backwards, or subtracting by 7. That's important. Oftentimes come up on test board or your board certification. 60 seconds. All right. Seems that you guys are getting it. Use process of elimination. Take your answer and go. Okay, very good. So that is the right answer. It didn't give you an age, right? It said adolescent. So it is a true statement. So children may require higher dose per body weight, not necessarily the dose of the medication, but per body weight, right? Because they have a more rapid metabolism. Okay. Next question. All right. Last question of the day, guys. Which the patient symptoms will warrant hospitalization the most? We have 90 seconds. All right, so we do have 15 seconds left. Okay, so that is the strongest, most, strongest one symptoms, right? One occurrence that you'd be most warned about, concerned about. However, if the question asks you to pick between patient A, B, C, and D, you have to count each symptoms for the patient. And in that case, previous suicide attempt is not stronger than than the combined total of the other patients. Okay, so be alert for that pitfall. Okay. All right. So Uma, she actually took the third place. Good job there. Kate, second place. And today's winner is Janet. You did it. Today was a very, very hard. Love, you came in fourth, and Claudia, you came in fifth. Good job, everyone. Thank you for attending today's event. I'm very, very proud of you for being here So what we're gonna do now is take a quick break. We'll come back and we'll discuss some questions, some concerns, and maybe some things that are important for your board that's coming up. I also want to emphasize that I just had two one-to-ones with our students. They're about 4 hours long together. I will be uploading to the course today. As soon as this is done, I'll be decoding, shrinking the footage so that the system accepts my tape, and then I'll be updating. So if you are testing soon, I really hope that you can take the time and listen to it, because we discuss very serious, very important tips for your success. Stay tuned. We'll be back in just let's say, let's do a 15 minutes break.